So thank you, and lovely to be here today. So as you can see, I'll be talking about as we're moving through the food system, the eating consumption part. I'll just briefly tell you a little bit about why talk about this, and what to do and how to do it. So here's the eating bit of things. And I'll just, so, there, yep. Okay, is it moving by itself? Okay. It does seem to be. Oh well, I'll yeah, okay. So if we go back to why, so there's, we've talked today a lot about it's so many different reasons why food is so integrated into everything that we do. So there's economic component to it, there's an environmental component to it, there's an equity component, and there's a health component. And so if we have a look next, David, at specifically the environmental component, food matters a lot and it impacts a lot on the environment. I mean, between 25% and a third of the food system is responsible for our Victorian footprint. On the other hand, food also impacts the environment. So what we do really, really matters. Next. Economic-wise, food is a big factor in our in producing and making money. So if we have a look at the food system, represents 15% of Victoria's gross value added, or it comprises and employs about 14% of the workforce. So really important, and we can't forget that even though we might want to do all these good things, it does play a role as far as our economics go. Thirdly, around health. You don't need to read the detail, but what this is showing you is of all the different issues, whether it's high blood pressure, whether it's high cholesterol, whether it's smoking, whether it's poor food, the one thing that makes the most difference to health, the one area where you could get most bang for your buck, is to focus on healthy eating. Because if you look at the top, it comprises about 15% of the burden of health. So if you want to make a difference, it's focusing on healthy eating, and as we're all here to do that today. Next is equity, and Nick's talked a bit about this already, but eating healthy, eating sustainably, eating culturally appropriate food is a human right. And Nick mentioned even down there below that Olivier de Schutter has taken that concept even farther and said, and it also matters how that food is produced and making sure that we're taking into account our future generations. So if we think about that, everybody has a right to food. Now this is just a little bit of way of looking at what to address when we're talking about healthy eating. What are the determinants of healthy eating? And if you think about it very simply as you need a supply, so you need the food, you need availability of it, you need to be able to get to it, to access it, so both financially and physically, and then you need to know what to do with that food, how to use that food. You have to have the storage, the kitchen facilities, and then fourthly, you need to know, and you need to want, you need the demand, you need to want to eat that healthy food. So when you're thinking about what to do, when we're talking about that today, think about those four issues, and they must be there. You need the supply, you need to be able to get it, you need to be able to know what to do with it, and you've got to want it. So that's what underpins healthy eating. Now, what to eat? Well, Michael Pollan says it most simply, eat food, so that is eat food in its most natural state, so not so much the processed packaged foods, but instead the healthier fresh food. Not too much of it, because we know what happens then. We've got a fair bit of an obesity problem when 68% of men are overweight or obese. 56% of women, and 25% of our kids. So we've got to really watch out for how much we're eating. And lastly, mostly plants. Some pigs, but mostly plants. Then another way to look at this, according to the Food and Agriculture Organization, a global body, make sure that what you're eating is healthy, so nutritionally complete, that it's safe, that it has low impact. So often a way to think about that is this in season, culturally acceptable, accessible, economically fair. We've talked a lot about that. So not only is it affordable for residents, but we want to make sure that that farmers are getting a fair price at the same time. So if you break down those 4 different areas in the last 30 seconds to look at what can you do here in your community today, if you look at supply, some of the best things you could do would be to develop up policies or plans. And so you might look at your you might consider urban agriculture, or you might consider plans around tourism, or you might look at urban planning. You guys have great farming, fertile land, so you might look at farming. I won't go through too much more of that, but also look at considering incentives, look at addressing barriers. So when you're talking, what I'm trying to get at here is, it's not so much about, as a dietitian, I love to tell people what to eat, but it's much more than that. It's looking at supply issues, access, and also looking at creating a demand for that food. And I think I'll finish there. Yeah. So City of Hume, you've got lots of food security issues, and you're one of the most disadvantaged communities, in Melbourne. But by addressing those 4 areas, you've got a chance to address food security. Yeah.